Even when I was a kid back in the 80s, there were Lego camps, there were robotics camps, and coming pretty soon on the heels of those by the 90s, there were coding camps and classes. My high school did have a pre-med club, but it was once a month and it was packed. It was in a science classroom and there weren't even enough chairs for everyone, so we'd sit up on the tables. And it was fun, but it didn't happen until high school, and it was just this one club, and there were all these other clubs that met every single week. Ecology club, philosophy club, creative writing club. I was president of the math club, and we met every week. And yet pre-med club somehow just kind of got tossed to the side as this thing that this one teacher did, but never really had the structure or the support that all these other clubs did. The thing is, teachers understand ecology and teachers understand creative writing, but how would a teacher understand medicine? They weren't a doctor. As a physician, I saw this problem and I fixed it. So before I tell you more about it, just let me tell you, don't worry, there's a solution. What I see nowadays is that I'm constantly bombarded by ads for coding classes and camps and tech clubs and robotics programs. All these things that are science, but they're specifically technology. We don't support the kids who are interested in medicine and healthcare and human biology. We're leaving out pre-med. We're leaving out the kids who want to be veterinarians and nurses and physical therapists and speech-language pathologists. Don't these kids count? Doesn't the science count as science? We've had such a fascination with engineering and computer science for decades now that we don't support kids who are interested in medicine and health and human biology. And when you really look back, this has been going on since before I was a kid. Look, kids are learning to code robots in kindergarten, but kids interested in the human body, they get shown a few basic diagrams and told to memorize the parts, rather than teaching them to think and explore and ask questions and really understand and do what's going on in healthcare. The same kids are just going along until they get to high school, where they're taking anatomy and physiology for the first time, and up until that point, they've had the same exact training as every other kid who has no interest in human biology. They've missed out on all these years and years of brain development and of gradual understanding that can build over time. We don't expect kids to go from learning the alphabet to writing novels. We do expect kids to go from memorizing a few little terms to understanding how the human body works without building up gradually. And that just doesn't make any sense. Just like we work kids from the alphabet to words to sentences to paragraphs to essays, we should be working kids gradually up through the steps of understanding the human body. Imagine jumping directly from counting all the way up to calculus. That just wouldn't make any sense. But that's exactly what we're doing in human biology, is we're going from this very basic understanding of biology right into the senior high school level class. We're jumping directly from naming a few parts, maybe seeing a dissection or holding a model, all the way to understanding everything without working all the steps in between. It's no wonder that so many people end up dropping out of the healthcare pipeline, the medical school pipeline, the nursing pipeline, because they don't have the skills and the knowledge and the understanding to be able to manage. And then they think it's their own fault, when it's not their own fault. It's they were never prepared adequately to begin with. Most people really stop with the anatomy they learned around second, third, fourth grade. We can name some basic organs, but let's be honest. Do most adults actually know more about their stomach or their spleen than an elementary school kid? Probably not. I mean, we all know that the stomach makes stomach acid and it helps digest our food, and adults probably know that you can get ulcers, but they may or may not know what actually causes the ulcers. And neither kids nor adults know about the enzymes in the stomach or the layers of the stomach. Most adults don't realize the stomach doesn't actually do most of your digestion. It prepares your food for what's going to happen next, but it just starts the process. It's really the small intestine that does most of the work. Most adults are shocked to learn that you don't actually need a stomach. It's convenient to have a stomach, but you don't actually need one. So we're all left with this elementary school understanding of the human body, including kids who want to go on into healthcare and medicine. I personally felt this gap. I also made that sudden jump from basic information to needing to understand everything, and I really struggled. To be honest, I didn't really know. I didn't really understand a lot of this stuff until I started teaching it. Like, I knew the information that I used, the information I needed in my practice and the medical information, but there were some really basic things that I didn't actually understand because I hadn't had time to stop and think about them, because I was just memorizing as fast as I possibly could, because there's just so much information that you don't have time to think, you're just memorizing. If I could have started at a younger age and had built on that foundation of understanding and worked up gradually, it would have made such a difference in medical school and residency and my whole life. Because instead of memorizing information, I would have known information. Kids of healthcare professionals get a real advantage here because they hear their parents talking. If their parents are paramedics or nurses or doctors or veterinarians, they're hearing this language, they're hearing the stories, they're getting the framework for understanding how it all works. And that gives them a real advantage over the kids who don't have that. During the early years of the pandemic, I was teaching both medical school and online classes for kids. By accident, I ended up teaching nearly the same topic in 2 different classrooms in the same week. One was the second-year medical students. The other was a live online class of kids, 8, 9, 10, 11-year-olds, stuck at home just like everybody else. Topic for the medical students was how to interpret lab results. The topic for the kids was anemia. With the medical students, I asked what they would expect to find if someone wasn't getting enough iron. They immediately went quiet and started trying to remember what it was that they'd memorized. I could see it happening. They were searching in their brain for the right term, the right fact, the thing they'd written down somewhere. With the kids, I asked basically the same question, and they just started thinking, well, iron is what makes red blood cells red. So if you don't have enough iron, then they wouldn't be very red, maybe pink, and you couldn't really fill them up, and so they'd probably be kind of small. And if your red blood cells are small and they're pink and they don't have enough iron, then they can't carry as much oxygen. So without oxygen, well, you're going to be tired and short of breath and maybe get dizzy and stuff. And your skin would look pale. And especially here in your fingernails and your lips where you can really see the blood and inside your mouth, those are going to look really pale because you can see the blood. They reasoned through all the signs and symptoms and the lab results of anemia from scratch using logic, better than the students who were studying medicine. Now, the medical students weren't less intelligent. They were exhausted and they'd been trained to memorize. And when you're that tired, you forget what you memorized. You have to be able to reason through it instead, or know it so well that it's just second nature, which is what doctors depend on, is we just know this stuff. We don't know how we know this stuff. I mean, we know we learned it at one point, but it's just like a fact. We know it. But as a medical student, you don't do that yet. And if you can't think through it, then it is so stressful and scary. And I remember going through that myself. So here's what this gap produces. Kids who are smart enough, interested enough, and capable enough to be doctors or nurses or veterinarians or genetic counselors, but they don't make it through the pipeline, not because they're not smart enough, but because they don't have the foundation. They jump into anatomy and physiology drinking from a fire hydrant, massive amounts of information, no framework to hang it on, and they struggle. And then they think it's their own fault. They drop out, they blame themselves, but it's not their fault. It's that we didn't prepare them adequately. We didn't build the foundation. We left them behind while we were busy building coding boot camps. Doesn't a kid interested in medicine deserve the same kind of pipeline as a kid interested in coding? Doesn't the science count as science? Don't these kids count? Right now, we're leaving them out. We're answering no by doing nothing. So I created MedPath specifically to fill this gap, intentionally. As a physician and educator who's watched this happen for decades, it teaches kids to think clinically about the human body the way coding teaches them to think like programmers, the way robotics teaches them to think like engineers. It starts young. It builds gradually. It teaches kids to think, not just memorize. If you have a kid who wants to be a doctor or a nurse or a veterinarian, they deserve years to build understanding before high school, before it becomes a fire hydrant. Go to drrobinschool.com/medpath and explore the preview classroom to see exactly what your kid would get. Take good care.